Good day, class. I'm going to be talking about osteoporosis and more in depth about the use of alendronate while having osteoporosis. And I made a lovely brochure for anyone who may want it for their own personal use. It's on Brightspace. Renee has it up there. So, osteoporosis, as we know, it is a condition in which your bone density decreases immensely. Maybe not as immense, that's a strong word, but you get what I mean. So our bones are naturally in a rebuilding phase, and as we're younger, we build more bone mass than what's being depleted. And then as we grow older, it kind of lessens, and up until age 30, is when it starts to switch around and we're losing more than what we're gaining. So it's important for people, especially younger, up until they're 30, to try and gain as much bone density as possible, because when you start depleting more, if you don't have much to begin with, it's an ongoing cycle. So there are conditions such as osteoporosis, which can increase the bone loss process, if you want to call it a process, we'll call it that. And usually for individuals with those, they'll prescribe alendronate. And trade name for that popular one in Canada is Fosamax. Fosamax, yes. And yeah, it's for individuals with osteoporosis. The most common side effects of taking this would be musculoskeletal or abdominal pain. Others include things like headaches, photosensitivity, blurred vision, possibly constipation, diarrhea, nausea, vomiting, big three. So for more on Fosamax, to be more specific, you should take it as directed. That is a big thing with any medications, but especially this one, because you can't double up a dose in a day. If you happen to miss one the day before, it'll cause more issues. So for anybody, if they happen to miss a dose, just wait till the next day, take it then. Because with this, you're supposed to take it in the yes, I am right. So you're supposed to take it in the morning. I was thinking that, but I needed to make sure. So you're supposed to take it in the morning. And yeah, if you miss a dose, wait till the next morning to take it. It's not that big of an issue. And also, after people take this, they are recommended to at least be sitting up for 30 minutes after they consume it. This kind of just allows an easier passageway to the stomach, and minimizes any esophageal irritation, so it might be a good idea. Usually a common dose for this would be like 10 milligrams or 70 milligrams weekly, whatever works. It's usually used that's usually used for men with osteoporosis or premenopausal women, and which we know postmenopausal women are a really high risk of getting osteoporosis because their hormones are depleting, and which kind of throws everything out of whack, which means that they're losing more bone density. So, fun fact. Some cautions that should be taken would be people who have hypocalcemia or vitamin D deficiency, as it can kind of lower the calcium levels in your blood. And if this is happening, some signs that you could look out for are confusion, muscle spasms, numbness, and tingling. And as I said before, while you're supposed to sit up, it can irritate your esophagus. maybe give you a little heartburn. Adenophagia, which didn't know what that was, come to find out, painful swallowing. Angina, dysphagia, or anything. If you do have any of those, you probably should report it. And actually on the back of this, if anybody has any questions, if they're using Alendronate with osteoporosis, they can call Telecare, so 811. And also there's a little pick-me-up quote on that, just to make your day a little brighter. So yeah, that's that on that.